Good day and welcome to another edition of Prostate Health Care Call to Action Roadshow. And today I'm really pleased that we have William Lammons, who is the Patient and Public Involvement and Engagement Lead for the National Institute of Health and Care Researchers Applied Research Collaboration North Thames. Good day, William.
Good morning. How you doing, Rudy?
All is well. All is well. Thank
Good
you.
deal.
So William holds a Master's of Art degree and a Bachelor of Arts in Anthropology. He has also conducted public involvement in health research in the UK at universities, charities, and the NHS since 2020. William holds over 10 years of experience conducting qualitative research and engaging with public groups in the UK, USA, and Latin America. William, tell us, what is PPIE?
Thanks, Rudy. So PPIE is patient and public involvement and engagement. And what it really means is it's a process of a two-way street. So it's when you do research with people with whom it will be affected, as opposed to about them or for them. So for instance, you're involving people who have prostate cancer in prostate cancer research, or people who could have prostate cancer, or people who are carers of people with it, or people who support charities with it, where you're taking them and bringing them into the research process as collaborators and literally helping them, giving them what they need so that they can do the research with you.
Thank you for that. So can you please clarify how PPIE reflects and represents the public voice?
So it's not necessarily that PPIE reflects or represents public voices. It's that it kind of opens up a space where people can represent themselves. It kind of opens up a seat or multiple seats at the table for folks to come in and be involved. In some ways, it's kind of a democratization of research, where you can bring people into this and they can look at the research together with you, and they can say, based on my lived experience, based on kind of what I know about this condition or this experience, this research question doesn't consider me. It allows people, so it reflects and represents people by allowing them to change the way that research is conducted. It helps them tailor research to what their needs are as patients, as community members, as family members, charity members, all these kinds of different things. Does that make sense?
Yeah, so when we say all voices must be heard, how then may that impact on a health researcher's perspective, or maybe biases?
I'm not sure. I'm not familiar with that particular phrase. But for me, it's kind of more about it's having a variety of different voices and experiences in the room. I mean, everybody has biases, but it's kind of about being open about biases and concerns so that people can so that there can be a kind of collaboration together. But I think the point is not for us to, I think the point is for us to be aware of our biases and be critical with them, and to challenge them, and to spend time working with people, collaborating with people who will help us challenge them. Yeah, does that make sense? Can you repeat your question for me?
It does, because also there's a increasing public expectation of a co-learning approach.
Yeah, absolutely.
From people within the systems.
Yeah. And I think PPI is one kind of, or PPIE is one kind of pathway to that. So sometimes we say the kind of older term is PPI, patient and public involvement, and they've kind of added the E on for engagement. But we use them all kind of interchangeably. I think PPI just kind of rolls off the tongue a little bit easier. But yeah, I think PPI or PPIE is that's I think it's a pathway to that. And I think it's kind of like there's a kind of public responsibility for researchers to make sure that kind of what they're doing is addressing the needs of the people with these conditions and that could get these conditions. Um, and the doing it with them is kind of a way to do that.
That's excellent, because what you're really saying that there is public access
Yeah.
through the PPI
Yeah.
care pathway to the actual care pathway where the services are delivered.
Yeah. I mean, it's a long timeline. It's definitely a long timeline. Um, as there is like because it's piggybacking on and kind of laced in with the long timeline of research, kind of from research to application to kind of changes in services. PPI is not necessarily a care pathway by itself,
No.
but it is kind of its care pathways are one thing that it can change or that it can update or that it can be a part of kind of addressing. And there is kind of like, and it's really not just you have an act, so we call them activities. It's not just like you have an activity, you get some people's thoughts and you update research questions kind of based on that, and then you move on and life goes on. It's more kind of it's when it's really done well and robustly and compellingly, it's about like building relationships with people. It's about building relationships with people so that over a period of time. And it's great to do kind of shorter things sometimes to get people's views to help you kind of frame where you're thinking and kind of where you're at, whether you're kind of on a more public kind of end of the spectrum or more of a research kind of end of the spectrum. But there's a need to kind of, at the absolute minimum, to let people know what their voices contributed to what you're doing, and then to keep them kind of in the loop on what the research has found and what the results are. So the engagement usually kind of refers to um, sharing the information, right? Um, what sometimes in research they call dissemination. Yeah.
No, that's excellent, because it kind of relates to my next question, because you kind of touched on access and some of the historic barriers to access. So
Yeah.
Do you require specific training or expertise to participate in PPIE?
So this is a
From
really
a
good
public
question.
perspective.
Yeah, this is a really good question. I really appreciate you asking this, Rudy. The expertise. So I'll take the back half of it first. So the expertise and training. So first, we consider members of the public to be experts by experience. So we kind of contrast experts by experience with experts by training or experts by education. People with PhDs or people with master's degrees, people with kind of formal training. We try and elevate lived experiences and living experience to a similar place of kind of qualification. Like, for instance, if somebody's going to know a great deal about prostate health and prostate cancer pathways if they have prostate cancer, like that, and if somebody's a carer for somebody with any kind of conditions, that's also going to ascribe them a certain amount of expertise by experience. So I try and use those terms and those concepts in a lot of what I do. So basically everybody can be an expert by experience. There's no specific training requirement, and people really, part of what I do when I'm training people in how to do PPI, when I'm kind of creating PPI activities, I personally try and design things so that it's easy for people to participate. So it's easy for people to kind of think critically about what's going on. And I try and just design things in an inclusive sort of way, in an accessible kind of way. Me personally, I have a lot of different and unique accessibility kind of needs that really kind of run the gamut. And whatever you're doing in terms of PPI, people are going to have unique needs based on their kind of experiences and their own lives of accessibility. So basically, no, you do not need training.
Okay.
There are trainings out there and those can help. And there is this whole question around research literacy. There's a big thing around research literacy, around terminology.
Yeah.
So it's kind of like researchers are supposed to do things in plain English, and they're supposed to do things in kind of lay summaries to facilitate things like PPI, to make it easier for people to be involved, share their thoughts, and contribute. But it doesn't happen. It doesn't always happen in ways that are that those members of the public really need.
Yeah, and again, there is an increasing expectation around cultural awareness as well.
Yeah, absolutely. But a lot of that's like, and I will say, if you're running the activities, you can't know everything, and the best it takes me back to relationships. Like, you really need to create those spaces where people can tell you about what they need and what they don't understand. What they don't understand and what they need help with, what they need. Everything from formats to words to terminology to preparation. Yeah.
Okay. So can you provide us with an example of how researchers influence change?
For me personally?
Yeah.
For me personally.
Absolutely.
So I've been involved kind of leading PPI stuff on a mental health project for almost 2 years now. And we have a dedicated like PPI panel for this project. And everybody on the panel has a very different sort of lived experience of the mental health context, whether that be kind of conditions or caring or charity work or et cetera. So one thing that the big goal of this mental health project was to raise the amount of research capacity to conduct mental health research. So this means that people will have the knowledge and skills in order to be able to do research. So it gave out kind of grants based on applications for kind of learning opportunities, fellowships and starter grants and internships and things like that. So there was a pile of grant applications. There was, we'll say, between 10 and 20 something. And so my panel members, we all looked at all of these grants. They looked at them all individually and they scored them all. They did comments. We created kind of an easy to answer sort of questionnaire with kind of 1 to 5 kind of ratings and relevant kind of questions. So we weren't asking public folks, if they thought the methods were robust enough and if the methods were appropriate to answer their research questions. We were asking them things like, will this person's project understand, address, or see things around mental health needs in community spaces? It was things like that, things that they would know about, things that we would kind of expect them to know about and kind of that we knew that they would know about. And so all of these people on this panel reviewed all of these applications. And then we had a couple of people go into a virtual room with us where the actual decision on funding was made. And so I was able to really easily point to this kind of data that we'd pulled together. I was really easily able to say, like, these are the 3 highest rated grant applications. These are, qualitative sorts of kind of one-liners about why people like them. And for further details, ask my great people that are here. Stuff like that. And it made a huge impact in how decisions were made around funding. And there was very much like a collaborative kind of moment with the more senior scientists who were kind of running this project and and this project was their baby, and the recommendations of the members of the public. So it was really, you could really kind of see it. And it was very, sometimes it's kind of a consensus building thing. And it's very much like a kind of compromise. It's like a Venn diagram, and you want to live in the kind of middle of the 2 circles. In a shaded in part that's the kind of relevance. So it's a long story because of all the context, but basically we fielded a bunch of applications. We got a bunch of great responses, and these members of the public helped us pick people, helped everybody on the project pick applications who were relevant to their experiences and to their lives and to the ones that they knew existed out in communities.
And it sounds as though you certainly picked up a lot more intelligence from the public in terms of how they feel about this particular area, and particularly such a long-term condition as mental health.
Yeah.
Well,
Yeah. And there's lots of little things like that. You know, people talk about, so people think about things like change. One more kind of research jargony word we use for this is impact. Like, what's the impact of this? What has it done? Um, and I feel like sometimes people really crave these kind of like,
mhm.
you told me to change this thing and I changed this thing. You know, you said that the ticket barriers were too tall, so we made them shorter, you know. But I think there's a lot of really almost kind of tacit sort of things like that. And
Yeah,
there's lots of really kind of qualitative things that are really hard to kind of um point to as like easy, like, okay, you like the color, it was orange and you told us to paint it blue, so we changed it to blue. You know, there's lots of really kind of things about relationship building that are not as easily like 1 to 2 as that.
no, absolutely, and particularly
Yeah,
where trust is again has been a
yeah,
historical issue.
yeah, for
Yeah,
good reasons,
yeah,
for
absolutely.
all the reasons that exist.
So tell us, what plans do you have for your next big project that you want to accomplish?
I think overall, I want to I want to have more community involvement. I
Mhm.
want to have so where I work is called the Applied Research Collaboration North Thames. So we're a division of the NIHR, and we're what's called a research infrastructure. So there's like 100 different studies in our program. Um, I want to have more community connections
Mhm.
between our PPI and between our studies. And I want more, I I want to help facilitate more relationship building and more kind of community involvement is
Mhm.
is a word that gets thrown around a lot more. Um, and I think it can mean like with all terms, it can mean very different things to very different people. But I really want those relationships to continue to be built and to be built in compelling ways. You know, folks like you, Rudy. Like,
Yeah,
I mean, you yourself are another one of these kind of big facilitators like this. You know, linking people together and
yeah,
helping build this trust and helping build these relationships. That's what I really want to be a part of.
yeah,
That's the kind of so I think that that's a big kind of thing sometimes in the
Mhm.
foreground, sometimes in the background of almost everything I'm doing. Like, how can I extend this further?
yeah. And in today's approach, so it's not only having the bridge, but the pathways
Yeah,
on the bridge as well.
exactly. It's kind of like there's like you know we're crawling so that other people can run kind of stuff, sometimes
Uh,
we're kind of we're kind of making the way so that it's
exactly.
easy. It's a procedure kind of thing. Once you do it and you can explain to somebody how to do it, it can it's a lot easier to kind of get people in the race.
Yeah, yeah. It sounds like the system lines of clarity, consistency, and
Yeah,
process. Yeah,
yeah, yeah. And there's support for all
yeah.
this.
Support.
There's support for all this, but it's there's always all kinds of different kinds of needs and everything.
Absolutely. And finally, William, what is the best experience you've had in this arena over the years now?
I think my favorite, we did a huge event in East London called East London Community Cafe on mental health. And it was a big public discussion with about 30 different people, all from Black and South Asian backgrounds, all with connections or residency in East London. I co-produced it with some amazing kind of community collaborators. We co-led it with them too. And it was really just, it's I find that I personally am having to remember how to do in-person stuff since the pandemic. I moved to the UK in 2020, and I started working in PPI in 2020. So it's kind of there's a learning to walk again kind of thing.
Sure. Yeah.
But I loved this because we had all of these different sort of interactive elements.
Mhm.
Our questions were like, what does mental health mean to you?
Yeah.
What do you want from mental health research? What are the best ways that we can do mental health research? How do you want to be a part? Questions like that. But then there were big kind of discussion sorts of things. There were tables of a handful of people And you could kind of write on everything. So we had paper tablecloths, we had, you know, notes and sticky notes and post-it notes. There was even a few kids there, and so we had coloring books for kids, and the weather was really nice, and it was kind of in the middle of Victoria Park, which is really hard to get to in some ways, and really hard to park cars at. But people really enjoyed the space.
Yeah.
People really enjoyed the space, and it kind of reflected this kind of thinking about mental health. It was kind of let's come to this kind of huge park together on a nice day, and kind of talk about this together. It felt really collaborative, and everybody. I really think that everybody there really had, and we had lunch and food and snacks and coffee and tea all day, and it was a lot. We had a long time, so it was kind of like 11 to 2. You know, I think it just felt really powerful, and I was really passionate about it. I'm really passionate about the subject. I have lived experience of mental health conditions. And I find East London to be a really compelling place, where a lot of different identities come together from a lot of different places. So it's just really exciting to be a part of that, and not to bring something to it, but to kind of try and create a platform where I can almost kind of put people on.
Yeah.
And we can have people come together. I mean, I'm trying to learn about all this too.
Great. All right. Well, thank you very much.
Thanks, Rudy.
And look forward to catching up with you again soon.
Sounds great, buddy.
Thank you.